Hi everyone, this is Dr. Dev. I'm a Chief Medical Oncologist, Hemato-Oncologist and Bone Marrow Transplant Specialist. Currently working at Medicover Cancer Institute, Vizag, Arilova. Today we are going to talk about the basic aspect, the backbone of medical oncology, that is chemotherapy. So whenever I say chemotherapy, many people will get scared. So many people come to us every day, so many cancer patients. We talk to them about various treatment options like surgery, radiation, radiotherapy. And whenever we say chemotherapy, very many people get scared. They said, we don't want chemotherapy. Yes, that is true. There's a reason for why they get scared. But let me decode or let me just simplify. The chemotherapy, there is a significant improvement has happened in chemotherapy protocols. What we used to treat earlier and what we are treating now. And how the drugs have significantly improved in terms of a reduced toxicity and improved efficacy. So what exactly is chemotherapy? What is the mechanism of action? How does this chemotherapy kill cancer cells? Chemotherapy is just a poison. Just technically it is just a poison. Chemotherapy can be extracted or produced. Earlier they used to produce from the poisonous mustard gas. They used to extract from the tree bark. They used to extract from the alkaloids like flowers, and they used to extract from various material sources. And even the small amount of this poison, whenever it enters the body, it goes and binds our DNA and it breaks the DNA of the cell, making that cell immediately, once the DNA breaks, the cell will die. And chemotherapy will not differentiate whether it is cancer cell or normal cell. So the effect of chemotherapy would be similar both on cancer cells as well as normal cells. So definitely chemotherapy would kill cancer cell, but along with that it also kills the normal cell. That's why we experience lot of toxicities. For example, hair fall, and for example mucositis, and then diarrhea, skin reactions. So all this happens because chemotherapy will attack high proliferative cells, like wherever there is increased growth, increased proliferation. For example, cancer cells, skin, and then gut mucosa and hair follicles. These are the areas where there is increased proliferation. So chemotherapy tends to attack high proliferative cells. Because of that, we get all these symptoms. But to mitigate these symptoms, there are, the drugs are really modified. For example, paclitaxel is the plain paclitaxel. Now we have better versions of that. That is nab-paclitaxel, that is protein-bound paclitaxel, and aqualic form. So these are the various forms of chemotherapy where designed to minimize the toxicities. Not only that, we have many drugs where we have better versions of these drugs available now, so that the experience of chemotherapy can be better or improved, and without much toxicities. And nowadays we don't use chemotherapy in all our cases. Whenever feasible or whenever required, we try to reduce the doses, or we try to avoid chemotherapies. Very often we try to inculcate targeted therapy. We try to include immunotherapy in our treatment options, and so that we can depend less on chemotherapy. But yes, there are few cancers where we cannot exclude chemotherapy. Chemotherapy is the backbone of cancers. In those cases, and we can design our schedule of the chemotherapy in such a way that the toxicity is very minimal. For best example is earlier we used to give chemotherapy once in 3 weeks, but now we are designing chemotherapy in such a way that we can give chemotherapy once in a week, so that the toxicity can be mitigated. Bye bye, take care.